Welcome back to News and Views, where we, of course, educating you about the different ideas and things that you should be interested in as far as life is concerned. And this is what the relativity is about at the moment, is COVID-19. We are in a second wave. It is getting very serious. South Africa has identified a new variant of the novel coronavirus, which authorities believe is driving a surge in COVID-19 infections that could and is already overwhelming the healthcare system. To talk about this new variant, on the line, I have Professor Ian Sanne. He's the director at the Clinical HIV Research Unit at the University of the Witwatersrand, his Faculty of Health Sciences, and Chief Executive Officer of Right to Care Group of Companies. A very good morning to you, sir, and thank you so much for joining us this morning on News and Views.
Good morning, and thank you for your interest.
It's so nice to see you taking the time off to actually educate us about COVID-19 and, of course, the new variant that is happening. I think a lot of us are in this confused state, Professor, where, we're trying to figure out what it is that we need to do. What is this new variant about, and is it really there? And what are the differences in this particular new variant? I mean, we had the first case of coronaviruses going around from March when we had the lockdown, but there's a different scenario now, and people are saying it's different. It's more aggressive than what it was before.
Yeah, so I think that we have seen really good data from very smart scientists that are world leading in their field out of the CRISP Institute, together with the NICD, NHLS, and Africa Center, strongly supported by Professor Salim Karim. And he, in fact, they have generated data to show that this new variant has an increased binding affinity to the actual ACE2 receptor. So the spike protein has 8 mutations that have increased its binding affinity to the ACE2 receptor. It is associated with a higher viral load. We therefore estimate that it would be associated with a higher transmission rate of COVID. We have equally seen this in a very rapid and spike in the incidence of COVID across many provinces. In fact, all provinces in the country, but mainly Gauteng, KZN, Eastern Cape, and Western Cape. Although it is going up in all provinces, we are seeing a rapid increase in hospitalization. We're seeing oxygen demand that exceeds the oxygen demand within the supply chain, exceeds the first wave. And so, in fact, we are very concerned that the health system is in trouble at this time.
Are the concerns justified? I mean, there's a lot going on right now. As we know, as you're saying, there's a surge in the amount of people actually going to hospital.
So, I mean, I think the question that others raise, and to some degree I can understand it, is whether, in fact, it's just about the fact that we're moving around, that there's a lot of movement in society at present, and whether in fact people are really just not practicing social distancing. They're going to big parties and the continued reveling, so to speak, including alcohol consumption, disinhibition, is leading to these transmissions. We are seeing an increased incidence in youth. There's many more young people being admitted to hospital, and in fact, even into ICU. So it is the youth who appear to not be adhering to the social distancing, and then bringing that back to their families, to their homes. And so, in fact, it is the sort of humanity defining what we're going to do next. Is really, we're calling on people to socially distance. I do think that we will hear an announcement from the president tonight on increased lockdown levels. And I do think that we will, these will not be stringent lockdown levels at this time. But if people don't hear the message now, then there will be no other way but to protect the health system by actually locking down further.
And it is indeed a very tough situation, because the thing is, how do you create that balance? Because the variant, as we say, it's worse than what it was before. And you're finding people are interacting because of the festive season. But it's like having to try and create that balance. I think that's the difficult aspect of it.
Yeah, I'm very certain that families that in fact can decide to socially distance will have a better chance at protecting the most vulnerable, those with comorbidities, particularly the older age group, overweight, diabetes, hypertension, HIV, all of the classical comorbidities that we've been describing repeatedly. And the young are not protected. So particularly the young overweight diabetics are getting into trouble. And we're seeing ICUs filled now with patients. There's definitely ICU doctors across the country that are having to make decisions on who gets into ICU and who gets high-flow nasal oxygen. There's more rural hospitals that are really struggling with cylinder oxygen and the resupply of cylinder oxygen. They are ending up with patients competing for mask oxygen, which means that the healthcare workers are under extreme pressure. As clinicians, we're also calling on government to really make a move now on vaccine. We're calling on SAPRA to really pay attention to the registration of vaccines and not wait passively for companies to actually submit dossiers, but in fact call on them using their emergency powers to submit dossiers.
Professor's talking about this vaccine. I'm going to interrupt you there. How different is this variant to the variant in the UK? Can we not possibly work with them to come up with this idea of a vaccine and a solution to, of course, helping people through this situation? And I mean, it's getting rather concerning, because as we see, we're sitting at the 1 million mark at the moment.
Yeah, so the case rates are definitely very high. The variant that we have in South Africa is different to the variant that is in the UK. It is a normal evolutionary process for viruses to evolve over time. They usually become more replication competent. Otherwise, they wouldn't. The new virus wouldn't become the dominant virus. We've seen the South African variant take over more than 90% of the transmissions occurring at this time. Certainly, that's what the data, the genetic data shows. Often that goes with a milder, more attenuated disease. But in fact, in this instance, we don't actually know whether the disease is milder or worse. But what we are seeing is many, many, many more people coming forward to hospital and our health system becoming overwhelmed. We do not have any data to show that the vaccines that have been developed up until now are going to be any less effective at this time. And so, in fact, we are quite confident of the vaccine technology. What's really important to realize is that influenza vaccines actually move with time. So as the genetic shift occurs, which is what's happening with coronavirus at this time, or genetic drift, sorry, I used the wrong term. Genetic drift is occurring. The vaccines can be readily and quickly updated. So this is not, at this point in time, there's no evidence to show that the vaccine would not work.
So I think the best advice that we can give everybody right now is to just basically follow the procedures, is to wear those masks, social distance, and of course stay at home and stay safe, because at this point in time, as we're looking, it's increasing rapidly because of the type of interaction that is taking place.
Yeah, so your byline, which I was listening to while I was waiting, I think was humanity deems the future. Maybe help me with the byline. Sorry?
Yes, we definitely. Salam Media is all about humanity, and it's about keeping humanity safe and uplifting them. And we can't do that if everybody's going to go out there and, of course, not follow the procedures. Because what's going to happen inevitably is, as we're seeing it right now, we're reaching the 1 million mark. And it's not going to get any better unless we follow our line, which is humanity is key.
I think that the humanity decision at this time is not to be a spreader. And it's not about your own risk and your own safety. It's about that of other people. And so, in fact, your citizen duty, your community engagement that you can do is to really assist people to practice the social distancing, yet avoid the depression of being in isolation on their own. And so that I think is a balance that needs to be found. And equally, I think to really, really, really honor the healthcare workers who at the front line have been dealing with this for over 9 months, who are exhausted, who have, it's not easy to watch people breathless and, essentially drowning and potentially dying of this disease. They have to have given a lot of the care that family members were unable to give. The stress on healthcare workers has been enormous and sustained. And so it is critical that, in fact, we really do honor our healthcare workers.
Oh, most definitely, because they are actually putting themselves right in the hub of all the drama that's going on there. And it's very traumatic. I mean, because they're having to deal with the mental aspect of it as well. And the types of effects that it has on them is totally impactful, yet they're dealing with the situation at hand.
Yeah, we're hoping that, in fact, the radio and TV stations of this country will actually take up a post-traumatic stress disorder type of show for healthcare workers and actually make it a routine, so that, in fact, our healthcare workers can know that they can listen in to people's stories in the afternoons, perhaps at 6, 7, or even in the evenings, perhaps after work would be better. To find a time slot that could be a routine with a psychologist assisting them to get through it.
We most definitely would love to, from the Salam Media team, have a look at that, Professor, because we have been through my show actually in the afternoons, enticing people into a better mindset with a mindset coach, discussing the anxiety and the depression orders that are coming out of this COVID-19 scenario. So I will definitely look at expanding on that and reaching out to those healthcare workers and of course, expanding on that particular aspect of it. So thank you so much for joining us this morning. We really do appreciate your time that you've taken to enlighten us on this variant. And of course, we hope that you do stay safe and nothing best for the future going forward. And we do hope, as they say, they come up with this vaccine and the solution real soon. It is rather getting bad.
Thank you all for your interest and stay safe.
Likewise. Thank you so much, sir. You have a lovely day going forward. Bye-bye.
Thank you. Bye.
That is Professor Ian Sanne, definitely giving us some insight into the variant and how much more intense it is to what it was before. So it's about staying safe, staying at home, doing that social distancing, and let's not forget to sanitize and wear those masks. Stay with us. We'll be back with you with a tribute for Professor Yusuf Korodia.